Life Transitions with Coach Robin. No matter what you're going through, you always have someone that you can talk to. Life Transitions with Coach Robin.
Welcome and thank you for tuning into Life Transitions with Coach Robin on 108 Praise Radio, where we are voicing the gospel all around the world 24/7. Meet Coach Robin every Wednesday at 8 p.m. Eastern Standard Time, where we champion life transitions together. Family, thank you for allowing me to be your personal motivator, instructor, resource, and friend. Coming up on Life Transitions with Coach Robin is our Health Matters segment. Oh, family, since it's August, Health Observances and Awareness Month, we here are declaring your health matters. Coach Robin wants you to prosper mentally, physically, and spiritually. I love this show that's coming up. Don't touch that dial. We are talking about babies, y'all. Babies, babies, babies. Don't touch that dial.
Welcome and thank you for tuning into Life Transitions with Coach Robin on 108 Praise Radio, where we are voicing the gospel around the world 24/7. Remember, family, meet Coach Robin every Wednesday at 8 p.m. Eastern Standard Time, where we champion life transitions together. Oh, family, since it's August, it is Health Observance and Awareness Month. And tonight we are focusing on prenatal care. Yes, and we have a special guest whom is dear to me and well diverse on this topic. So, family, welcome Dr. Carolyn Marbury to the show. Hey, Mama Carolyn, how are you tonight?
Oh, all is well. Fine, thank the Lord. I am doing great.
Awesome. I know a lot of the questions I'm going to ask you tonight, but for the sake of the listening family, if you will be so kind to give them a little bit about your background and what you do.
Oh, absolutely. For the past 30 years, career professionally, I am a registered nurse, and my background, first and foremost, was pediatrics. I've worked in pediatrics for about 4.5 years in a high-level intensive care unit. And then following that, the rest of my career, the other 26 years, has been in in-house or in the hospital obstetrics. And I've worked in labor and delivery, and I have some postpartum experience as well.
Wow. That is amazing. Now, I know if you wouldn't mind, give them a little bit about your schooling and a little bit about the degrees and things that you have. I know we don't I know you a humble woman of God as well. But if you can just share with the family a little bit about some of the things that God
has
given
you. Yes, I will. Absolutely.
Yes.
I was first and foremost trained here locally in Maryland. I went to a community college, so I do have an associate's degree in nursing. Of course, we all pass our nursing exam, and we get RN. And there's some higher certifications that I had to obtain as by my job requirements. So I also have certification in electronic fetal monitoring.
My God. Well. That is amazing. And you have been in that arena, prenatal care, for over 30 years?
Yes, I have been dealing in the area of obstetrics in 26 years, the past 26 years, yes.
My goodness, that is amazing. Now, from what I believe I know, you also have been blessed to be in the NIC unit. Is that true?
Well, sometimes we have to cross train. So I do have some, I'll say, some helping experience in the NICU, but that has never been my primary area. As for stated, I have 4.5 years of experience in pediatric intensive care, which is a little bit different from neonatal intensive care, but it's still dealing with sicker babies that are not on a regular floor unit.
Wow. So since we're talking about prenatal care, I guess the first thing I want to talk about is for those that are listening and listen, family that, are married, newly married, a lot of couples want to have children. And what are some of the things that you would tell a woman that is in the mindset of her and her husband, they want to prepare for having children?
Yeah, go ahead. I'm so sorry.
What are some of the things that you would advise, or from being in that arena? What will be some of the things you would recommend that a woman would do to prepare her body, or even a husband to be prepared to make that transition, or to, because a lot of people struggle in having children. So
one of the things I always recommend is, after agreeing that you're going to get pregnant or try to get pregnant, is your personal health care. Because whatever the environment is, our woman's body is an incubator. So we want to make sure that environment is healthy. That environment is in a place where, so you might want to have a discussion with your primary care physician. If you haven't gotten a physical, it's always good to have a physical to see to have blood work taken, to see where your how your blood count is, the status of your iron for women. Because when we have our monthly, we lose a volume of blood every month. So you want to make sure all those parameters are in place. You want to, see what your doctor recommends for you. Maybe a vitamin. You might need a vitamin. You might need particularly vitamin B, or, like I said, iron supplement. The next thing is you want to make sure all of your personal immunizations are up to date. Now, I know that we live in a different time, and people or our patients, or as we call them in the patient base, as well as our clients, have, you have a right to refuse, some immunizations for a long period of time. There have been stories out about immunizations, but I still highly recommend them because we live in a vastly populated communities. We're in school, we're at work, and even, just going to the grocery store. We want to make sure that our body is protected, that we are not passing anything on to the baby. And then if you have any medical conditions, because I know as time is going on, we've noticed in our patient population that some of our moms are a little older, just meaning that, sometimes people, work their career, husbands and wives or couples are in their careers, and professionally they want to be sound and strong. So they have the right environment to bring this beautiful baby into. So we're a little older. So sometimes there's other medical conditions like hypertension and diabetes and so forth. That we need to make sure those things are in balance before, and we have our doctors okay before trying to get pregnant. The other things I would say that you would want to avoid prior to getting pregnant, if you are doing them, is smoking, alcohol, or any kind of, I'll say, habitual drug use. And then we want to be careful of our weight. There was an old saying a while said, well, you're eating for two, and you're not really eating for two, but you do want to have you do want to manage your calories and have a healthy diet and healthy nutritional intake.
Wow.
The other thing is going forth, and this is just medical in general. We don't know enough about our family health diseases, our family's health background. Did someone have, hypertension? Did somebody in our family, have a blood disease? Do people in our family have problems from waking up from anesthesia or have allergic? What are you allergic to? A lot of people in the population are allergic to penicillin or other kind of antibiotics, or people are allergic to these things. There's things that we're allergic to that are important in our medical history. And again, I'm getting back to knowing the things that were in our family. And sometimes our families are not as vocal, but even our founding now is very important to know for women, depression and most importantly, postpartum depression. Was there an aunt? Was there a cousin? Is there a sibling or someone or a grandparent who is actually suffered from postpartum depression? And what about your husband's family or your mate's family? What about that person's family? Blood diseases, again, the usuals that are in our community, the hypertension, the diabetes that sometimes comes later in life. Those are the things that you need to ask questions about. Those are the things that you need to know, because those are the questions the doctor is definitely going to be asking you.
Wow. So I know you were saying it's good to know and find out a lot of generational, cultural things that we have that may be in our bloodline. Now, What do you recommend? How is is that something that you can do at your primary doctor, or is it something special, what they call it, a specialist that you would have to go to find out some of that basic information?
Well, if it's something, I will tell you this, if it's something that will affect the baby, if it's something that's going to affect the pregnancy, there is genetic screening, and that's the other thing. Whatever screening they've already appropriated, the screening that's appropriate for your age group. So there's certain screening that if you're in your 20s, I'll say up to 25 years old, that you won't need. But at 35 years old, that screening may be or will be required, or I'll say it's recommended. We don't, in the healthcare community, it's almost like shopping nowadays, going to the grocery store. They want more and more for the patient or the client to be involved in their care. So they will offer you these screenings, but if they are highly recommended, I would say that you agree with the screenings, because there's information that they can attain about the baby's development that will be in these screenings. But not necessarily are these screenings necessary before getting pregnant.
Wow. But it sounds like when you do find out, that you are pregnant, that you and your spouse are ready to, you find out you're going to have this bundle of joy, At that point, it sounds like you have an option to find out or to inquire about, was it genetic? You said genetic?
Yes, possibly anything genetically. And that kind of information, again, could be passed on by family members, or it could be something that they pick up in the blood work based on your age. Wow.
One thing I love about this time, as far as we say in this in this time that we live in, 2018, we have so much technology. We have so many, the advancement in the medical arena is really advanced, and things that we didn't have, even when I was having kids, is so much advanced even now, and I'm quite sure.
Oh, absolutely. It changes so quickly.
Wow. It's just something that came to my mind. being that you're in the arena, you see